Well, that's a good question. What my view on this is that you should strive as soon as possible to bring the symptoms of the patient into remission. And for patients, it is stool frequency, it's rectal bleeding, which is very worrying for them, and it's urgency. And that should be done as soon as possible. But then, as IBD and ulcerative colitis is a lifelong disease, they need to be controlled over time. So the status now is that symptoms should be all gone and should not return, and also that there should be some degree of endoscopic improvement too. But I think the symptoms of the patient, as they report it, are more important than that. But we're not accepting any flares in between times anymore. I think there's different obstacles. It's the patient. If you monitor that just in clinic visits, in your ambulance, in your outpatient clinic, then for the patient they have to travel to see you, and your time is limited as a physician. So the obstacles right now is that we can't see the patients as often as we wish to. And in the future, I think mobile health with applications, web-based or on a smartphone, will help us to know our patients are still controlled without us seeing them physically. Well, they will benefit by having a normal life, taking control over their disease again, which is very important for patients. They know they have a chronic disease, but they don't want to be chronic patients. And we have seen associations with decreased need for colectomy, better mucosal healing, but more importantly, if they have continuous clinical control, they have better quality of life. So it all speaks to a patient doesn't have to worry anymore about their disease. They can just go on with their lives without worrying. They have to take their medication, of course. They sometimes have to go to the hospital for an infusion, or they have to inject themselves, but at least they can live normal lives without having to worry about their disease. I'm a big proponent of that. I think we see a lot of young patients, their mobile phone is part of their lives. They use it all the time, and they won't mind reporting to us how they feel for that week, for example, whether they have symptoms that could mean a flare. So I think the patient will be very compliant, and for the physician, it will help them to invest their valuable time in patient contacts that are really needed, new patients, when changing medication needs to be discussed, or when they need to see the patient with a high-value consultation. I don't think that I said that it replaces the patient-reported outcome. What I feel is that on the long term, we also should look at mucosal healing, because we know that if patient on top of symptom control also achieves mucosal healing, that it's associated with better outcomes, which is no need for colectomy, but also a decreased risk of dysplasia and colorectal cancer. And I think that is very important when you're speaking 20-25 years down the road.